Hello, I'm Sal Sanders. It would be my pleasure to demonstrate an alternative technique for palpating and targeting the radial artery during arterial blood gas sampling. This is very important because having an arterial puncture procedure done is uncomfortable enough if you manage to get the sample on the very first attempt. And in some cases, if you have difficulty properly palpating and making that initial approach, you may need multiple attempts to get that sample. Most of the procedures for arterial blood gas punctures will show the palpation being done with 2 fingers and the puncture being done just prior to the finger here. Some will have 2 fingers to start with, and again the fingers perpendicular to the artery, which is running this way down the arm. Some will have demonstrated with lifting 1 finger just prior to the puncture. The technique that I'm going to demonstrate is a slightly different technique that I call the Sal technique, and that stands for single finger aligned linearly. So the finger aligned linearly with the artery running in this direction, the finger being placed here, and then slowly rock the finger back and forth until you can actually feel the curvature of that artery. Feel where the pulse is the highest. That should be the center of the artery. And then once you've located that, line up the center of your fingernail with that point where the pulse is strongest, which should be the place where you're at the center of the artery, and then make your puncture at a 45-degree angle just before your finger. You don't want to stick your finger during the procedure. Pretty simple. I used to show this technique to students who were having difficulty getting arterial blood samples, and the technique helped their performance quite a bit, but those were just anecdotal observations on my part. So Dr. Caldwell and I decided to see what would happen if we taught people who were just learning this technique from the start, and not just the folks who were having difficulty perhaps targeting that artery and hitting it using the traditional techniques. So that's the purpose of this video and the purpose of the research project that you're currently involved in. So again, traditional techniques would have the fingers perpendicular to the artery, and in this case, the whole feeling of where that pulse is, at least in my opinion, is spread out over a much broader part of the finger. Whereas with the Sal technique, when you're aligned linearly with the artery, you can palpate right on the tip of your finger there, line it up with the center of your fingernail, and it makes it much easier to go ahead and hit that artery on the first attempt.